I want to explain to you something that I started before I had my stroke and continued afterwards, something called liposomal therapy. Liposomal therapy is the new nutrition. It is what is going to happen in the years immediately following, because this works. The biggest problem in nutrition today is the absorption of nutrients. I can say to you, take this, take that, take it all together. But if I don't know how well you are absorbing that nutrition, I may not be doing you any good. Some time ago, and I'm not that smart, someone else discovered liposomes. Who was it? The cosmetic industry. The cosmetic industry discovered liposomes because they said, now we can introduce a nutrient to the body through the skin. We can change the skin. We can change the tissue immediately underneath by giving it a liposomal bath, if you will. Then, someone way back in the dark room of a company started saying, hey, maybe we can use liposomal drugs to affect the human body. And a lot of research has been done. I'm thankful that the research hasn't been too successful, because drugs aren't the reason that we have disease, but they have proven that they can take drugs into the body. They can take drugs into the body like they've never done before through the use of liposomes. I don't have a lot of time left, but last year I gave you a short dissertation on what liposomes are all about. I'm going to repeat that, and then I had a chance to do another one. I'm going to show you that one shorter. But anyway, this particular presentation on liposomes should help you understand that liposomes are a way of giving to you things. As an example, I'll talk to you now, resveratrol. Everybody has heard about resveratrol. A lot of you may be taking resveratrol because it's been said, that lady on the newscast, whatever her name, she did a whole hour on resveratrol and saying how good it was in the laboratory. But she said it's not so very good because you have to drink about 170 bottles of wine a day in order to get enough liposome into the body to do some good, and it just isn't well absorbed. If you look up resveratrol, you'll see very clearly everybody says it isn't well absorbed. Of course, a lot of people are selling resveratrol, and resveratrol is an excellent product. But if you don't absorb it, of what benefit is it to you? I think we now have a way of absorbing CoQ10, resveratrol, glutathione, a lot of things that we know are good. We give them IV pushes of glutathione for Parkinson's patients 10 years ago. And it was good. It was excellent. People who couldn't put one hardly foot ahead of the other were running up and down the aisle, making the turn, that had Parkinson's disease within 30 minutes of having an IV push of glutathione. Now, of course, it didn't last a long time. You had to do it regularly, but it did indicate that glutathione had something to do with Parkinson's. I wasn't smart enough to get that research. I got that from another doctor, but regardless, it can now be done. Anyway, oral nutraceutical can equal IV administration. What a big break for people like myself who are in the alternative industry who want to do something. Next.